Guys, today we're going to talk about a condition called gastroparesis. It's a condition that affects the stomach muscles, preventing complete stomach emptying. Normally, stomach muscles will contract, and when they contract, it causes gastric motility or peristalsis, which moves food slowly through the GI system, allowing things to be absorbed, nutrients, protein, things like that, and then you'll eventually pass out your waste. With gastroparesis, the motility is slowed and even stopped. The cause is often unknown. However, there are certain things that can make you more prone to it, like gastric bypass surgery. Anytime you have surgery in the GI area, you can be prone to that. Severe viral illness, diabetes. You can have issues with the vagus nerve, where if the vagus nerve is damaged or hindered in any way, it can cause slowing down of the motility of the stomach. Also, you can have an autoimmune condition which actually attacks the lining of the stomach, and that can cause the gastroparesis as well. As far as symptoms, you can see nausea, vomiting, bloating, constipation, weight loss, and not the good kind, pain in the GI area, feeling full after just a few bites. You take a little bit and you're just like, no, I just can't do it. Vomiting up undigested food, not going to the bathroom, like severe constipation where you have to, but it's not coming out. Lack of even desire to eat. And then, of course, in the long term, you can look at things like blood sugar changes as well as malnutrition. And we don't want to get to the point of malnutrition. A lot of people, especially early on, don't even realize that they have this condition. They may notice that they're not going to the bathroom as much as they were, but that doesn't mean that the malnutrition is not occurring. Nutrient depletion is still occurring, and dehydration is also occurring. And that's tough to keep track of. Dehydration, an easy test is if you pull up on your skin, if it doesn't go right back down like that, I'm really hydrated. You're dehydrated. You need to get some water in. As far as risk factors, again, diabetes will make you have a risk factor. Cancer patients treated with radiation is at a higher risk. Again, the surgical procedures, viral infections, serious viral infections are an issue. Patients with scleroderma have issues with that. Cystic fibrosis and Parkinson's disease also can cause problems with that, as well as multiple sclerosis and hypothyroidism. So that's a fairly common disease right there that you may not pick up on. So if you have hypothyroidism and any of these symptoms that I'm describing, you want to let your doctor know as soon as you can. Something else that can happen is medications can cause issues with this, causing it. Opioids are by far the number one issue with that. GLP-1s also can cause this issue, as well as certain antidepressants, especially tricyclic antidepressants, so amitriptyline, nortriptyline, drugs like that. They dry everything out, which slows the motility of the GI tract down. You can also see clonidine will do that, as well as progesterone. So some hormone replacements, you can see that as well. Calcium channel blockers. So certain blood pressure medications can also cause that problem. As far as complications, the main complication that you will see is dehydration due to nausea and vomiting, and then of course the malnutrition. When you're not taking in what you need, you're not only losing weight, but say you're low in your vitamin B vitamins, that can cause brain fog. It can cause tingling in the toes and the fingers, muscle spasms as well if you're not getting the magnesium and potassium that you need. Also, blood sugar changes can occur. And then one of the worst things that can occur is a blockage, where the food actually hardens in the GI tract, called a basor, that will not allow your stool to actually pass by. So you will vomit. And it can be a life-threatening condition. So if this kind of thing happens where you're vomiting solid food, you haven't pooped in like 3-4 days, you need to get into the doctor. And then also you can get esophagitis as well, as the lining of the esophagus is going to be inflamed and damaged from all the vomiting that's occurring. As far as treatment, nutrition and hydration, you've got to stay hydrated. and supplementation with multivitamins, vitamins, and nutrients as far as that goes, because you're not getting it. Changes in medication is the easiest one. If you're on a tricyclic antidepressant, look to change to another antidepressant. That won't be a problem. If you're on a GLP-1, you may need to change to something else as far as that goes. If you're on an opioid, look at changing to either another opioid or decreasing your dose. You can also use some medications like metoclopramide, which is Reglan, which helps to stimulate peristalsis in the GI tract. It can also be treated with a motilin agonist like azithromycin or Zithromax or erythromycin. Now, if they do that, those are antibiotics, and there could be antibiotic resistance using it long term. However, this can be a serious condition. Erythromycin would actually be the preferred on that. But you need to be on a probiotic, especially because you're having issues with your gut anyway. And then the final option, of course, would be surgery. Don't let any of these symptoms go on for a prolonged amount of time. Get in to see your provider if you think you might have this.